Well, I've learned that it can be improved. I thought this was the end of the line. And at least I'll get better.
Yeah, it gives me more confidence.
So in Enfield, we are really proud of our partnership and integrated arrangements. We've got long-standing arrangements under the Enfield Borough Partnership Board, and we have prioritised long-term conditions which heart health is a part of.
We've known for a long time that people like to only tell their story once. We find out that development neighbourhoods will allow us to to work more collaboratively together. I think that's important for patients, for service users, because it means that they're not always repeating. It means that people can have a discussion once, work out a plan together, and that's very important to an individual, I think, to understand where they're heading with their health situation or their social care situation, whether they're going to get some support from statutory services or whether they're better off getting some support from our local voluntary and community services.
With the Health Inequalities Heart Failure project, it works differently because we're specifically targeting the admissions to ED and full admissions to North Middlesex Hospital. We've had a high rate of readmissions with heart failure to North Mid. So we are examining each admission and we're discussing them with Dr. Rear, our heart failure lead, to see whether their diagnosis is confirmed.
So there are patients that we discuss already under our caseload who we talk about their management and progression. Quite a useful bit of the discussion focuses on people who are not known to our caseload, who may be on a GP register, may have come into A&E or may have DNA'd their heart failure clinic follow-up, and these are the patients we're really focusing on because they haven't yet been engaged in the heart failure follow-up and investigation. So those are the patients that really make a difference for, and we can identify them at an early point, arrange clinic follow-up where needed, get them onto the appropriate medications, have education with the nurses and pharmacists.
We're reducing those readmissions with our heart failure nurse interventions. So we collaborated with Enfield GP Federation and with clinical pharmacists working on the East Enfield's GP surgeries. We've worked in 7 surgeries now, and the clinical pharmacists have been fantastic at reviewing their lists, discussing patients in the MDT again with Dr. Rear.
Clinical pharmacists, for example, play a key role in medicines optimization, titration of heart failure medication, and patient education. Having this integrated model has allowed us to become a little bit more proactive with care, where we reach out to patients, identify the problems that they may have with their long-term conditions, and we kind of negotiate a plan within a multidisciplinary team. And using that information, we can help improve care. And this is a big shift from that traditional model where we look outwardly to all the resources that we have to help make care better and more holistic.
So we've been working with the Healthy Hearts programme in Enfield now for the last few years. A great example of that has been when we have large events with multiple stallholders and multiple speakers, so people really benefit from those different topics, things that they might want to ask their GP about but don't actually go to their GP for. So they may have come to us for one particular reason but then end up having their blood pressure checked, finding out more about heart health. They may have not been able to do that because they care for someone and not been able to leave that person at home.
The patient focus group, it's been difficult to get patients with heart failure to a group, but it was really important to us to hear their views, to hear what they think about living with heart failure, how we work as a team to support them, what we could do better. But it was really successful. We had 11 patients attending. We started off with teas and coffees, which was lovely, and then we discussed heart failure, the diagnosis, what it means to patients, discussing signs and symptoms, and we had a little bit of a quiz. And we discussed things like managing medication, symptom management, monitoring their daily weights, fluids, intake, and when to seek help.
I think the group today was very nice, very pleasant, and I learned a lot about how to manage tablets and such and such and such.
It helped me to feel better in myself.
Yeah, and I think this is the beauty of having this virtual MDT. So for patients with limited mobility, we can get involved and give that sort of senior specialist oversight, but the care is obviously delivered in the patient's home with the nurses.
I'm most proud of the recruitment of the heart failure nurse and our healthcare assistant. They've done the heart failure courses, they've developed their skills, and now they're working independently.
Yes, my nurse Amanda helped me a lot, and even when she comes to the house, she's very good to me and the wife.
My art nurse, Anis, is very helpful. When the chemist can't find the medication, when they've run out, he finds the chemist who will prescribe it.